Hello, future lifesavers, and welcome to our presentation on emergency management of diverse patient scenarios. Before we begin today's presentation, I would like to give a brief trigger warning. We will be discussing sensitive topics such as drug overdose, acute alcohol intoxication, sexual assault, and human trafficking. While it is essential for us as nurses to be prepared to handle these situations professionally, I understand that these topics may be personally triggering for some based on their life experiences. Please know that we will not be going into graphic detail, and our focus will be on the nursing care and support for patients experiencing these situations. If you find yourself deeply triggered by any of these topics, I encourage you to seek out support so you can become an effective advocate for your future patients. As a survivor of domestic violence and sexual assault myself, I understand the emotions that may arise during this discussion. If you would like to talk or need support, please feel free to reach out to me after class. I'm here to help and support you as we navigate these difficult topics together. Remember, our goal is to provide the best care for our patients, and that includes preparing ourselves to manage these situations with compassion and professionalism. Let's look at our objectives for this presentation. We will define drug overdose, acute alcohol intoxication, sexual assault, and human trafficking. Discuss emergency management strategies for each scenario, explore nursing interventions and rationales for diverse patient scenarios, and understand the importance of a multidisciplinary approach in emergency care. As we embark on our journey into the world of emergency nursing, it's essential to understand the diverse situations we may come across. On this slide, you'll see the 4 scenarios we'll be examining in detail. Drug overdose. This occurs when a patient has ingested a toxic amount of a substance, leading to severe consequences or even death. As nurses, we must recognize the signs of overdose, act quickly to stabilize the patient, and provide essential support during the recovery process. For instance, we might encounter a patient who has overdosed on opioids or prescription medications, and these will require different management approaches. Acute alcohol intoxication. This potentially life-threatening condition arises when an individual has consumed an excessive quantity of alcohol in a short time frame. We must be able to identify the signs of alcohol intoxication, such as slurred speech, impaired coordination, and altered mental status, and provide appropriate interventions, including monitoring vital signs, ensuring airway patency, and administering fluids or medications as needed. Sexual assault. This deeply traumatic event can have lasting physical and psychological consequences for the victim. As healthcare providers, it's essential to approach these cases with sensitivity and understanding, offering comprehensive care that addresses the patient's medical, emotional, and forensic needs. This may involve performing a sexual assault forensic exam, providing prophylactic medications, and connecting the patient with resources for emotional support. Human trafficking. This heinous crime involves the exploitation of individuals for various purposes, such as forced labor or commercial sex. As nurses, we play a vital role in identifying potential victims of human trafficking who may present with signs of physical abuse, malnutrition, or psychological distress. It's crucial to create a safe environment for these patients, assess their needs, and collaborate with other professionals and agencies to help them escape this situation and begin the healing process. As nurses, it's crucial that we are prepared to manage these situations with skill, knowledge, and empathy. So let's look at each scenario and learn how to best support our patients in these challenging circumstances. Let's look at the emergency management of patients experiencing a drug overdose. It's crucial to bear in mind that when treating a patient who has overdosed, every moment counts. Here are some vital steps to follow. Assess the patient's airway, breathing, and circulation. This is the cornerstone of any emergency care situation. Ensure that the patient has a clear airway and is breathing effectively. Be prepared to provide CPR if necessary. Gather as much information as possible about the substance involved. Obtaining details about the type of drug, the quantity ingested, and the method of administration can be invaluable in guiding the appropriate treatment. For instance, a patient may have overdosed on prescription medications, illicit drugs, or even over-the-counter substances. Administer specific antidotes if applicable. Certain substances have unique antidotes that can reverse the effects of the overdose. In addition to naloxone or Narcan for opioid overdoses, there is flumazenil for benzodiazepine overdoses, or activated charcoal for some types of oral poisonings, or vitamin K for warfarin overdoses. Provide supportive care. Depending on the substance and the severity of the overdose, the patient may require interventions such as supplemental oxygen, IV fluids, or medications to manage symptoms like seizures or agitation. In some cases, the patient may need more advanced care, such as mechanical ventilation or hemodialysis. Monitor the patient closely. Continuously observing vital signs, mental status, and symptoms is essential to ensure the patient remains stable and to detect any changes in their condition. This may involve using cardiac monitoring, assessing neurological function, or tracking laboratory values. As nurses, our role in managing drug overdoses is to deliver prompt, comprehensive, and empathetic care to our patients. By following these steps, we can help save lives and minimize the long-term effects of a drug overdose, giving our patients the best possible chance at recovery. Now let's look at the emergency management of patients with acute alcohol intoxication. Alcohol-related emergencies can pose unique challenges, but by employing the right approach, we can guide our patients safely through these difficult situations. Here are some essential steps to follow. Again, assess the patient's airway, breathing, and circulation. Just like in any emergency scenario, it's crucial to ensure the patient's airway is clear, they are breathing effectively, and their circulation is stable. Be prepared to provide CPR if necessary. Monitor vital signs and mental status. Vigilantly observe the patient's vital signs and their level of consciousness, as these factors can change rapidly in cases of acute alcohol intoxication. Watch for signs of alcohol withdrawal or worsening intoxication, as these may require additional interventions. Manage symptoms and complications. Patients with severe intoxication may experience a variety of symptoms such as vomiting, seizures, hypothermia, or hypoglycemia. When someone consumes alcohol, the liver may neglect blood sugar level maintenance in favor of breaking down the alcohol. So that is why the person may then experience hypoglycemia. People with diabetes need to pay particular attention to their alcohol consumption because of its effect on blood sugar levels. Be prepared to manage these symptoms and address any complications that may arise, including aspiration or electrolyte imbalances. Provide supportive care. Administer IV fluids and electrolytes to help maintain hydration and correct any imbalances. They may have a banana bag, which is a combination of mostly B vitamins, but some other vitamins to help to deal with the withdrawal from the alcohol. Offer oxygen therapy if the patient is experiencing respiratory depression or oxygen saturation levels are low. In some cases, patients may need more advanced care, such as intubation or mechanical ventilation. I once had a patient brought in by some friends of his in the back of a pickup truck. He was unable to maintain his own airway. However, when we went to intubate him, that woke him up enough that he ended up kicking me in the forehead with a steel tip boot. That was not fun. Implement safety measures. Ensure the patient's environment is safe and secure to prevent falls or injury. Use restraints judiciously and only as a last resort to protect the patient and staff. Monitor the patient closely for signs of agitation or delirium, which may require pharmacologic interventions. Educate the patient and their family about the dangers of alcohol abuse. Once the patient is stable, provide information on the risks of excessive alcohol consumption and available resources for help, such as counseling, support groups, and treatment programs. Encourage open communication and involve the patient's family in the education process. As nurses, our role in managing acute alcohol intoxication is to provide comprehensive and compassionate care. By following these steps, we can assist patients in recovering safely and reducing the risk of further harm, while promoting awareness and support for those struggling with alcohol abuse. As we progress in our discussion, it's important to highlight the unique role of male nurses in the care of female victims of sexual assault and human trafficking. Recognizing the vulnerability and rights of these patients is crucial, and our care should respect their wishes while fostering a sense of safety and trust. When caring for female victims in such sensitive situations, male nurses must be especially attentive to any signs of discomfort or hesitation from the patient. If a patient expresses a preference for a female nurse, it's vital to respect and support that decision. Keep in mind that this preference is not an evaluation of your skills as a nurse, but rather reflects the patient's need for comfort and safety during a challenging time. In cases where a patient may not feel comfortable voicing these concerns, it's essential for male nurses to be proactive in encouraging open communication. You should suggest the option of having a female nurse or chaperone present. Taking this initiative can help create an environment where the patient feels at ease expressing her needs and preferences. It's essential to be sensitive to the patient's emotional state and provide compassionate, empathetic care. Be patient, actively listen, and validate the patient's feelings and experiences. Encourage her to ask questions and voice her concerns, and provide thorough explanations to address any misconceptions or fears. Ultimately, our goal as healthcare professionals is to promote patient comfort and trust, ensuring that we provide the best care possible while respecting the individual needs and rights of every patient. By being supportive, understanding, and proactive in addressing these concerns, male nurses can play a vital role in caring for female victims of sexual assault and human trafficking and contribute to their healing process. Now let's discuss the emergency management of patients who have been sexually assaulted. It is crucial to approach these situations with sensitivity, empathy, and professionalism to support the patient through a deeply traumatic experience. Here's how we can provide effective care. Prioritize privacy and confidentiality. Ensure that the patient's privacy is protected throughout the entire process. Keep conversations confidential and minimize the number of people in the room to maintain a safe and comfortable environment. Establish trust and rapport. Approach the patient with a gentle, non-judgmental attitude. Listen actively, validate their feelings, and reassure them that they are not to blame for what happened. Perform a thorough assessment. Obtain a detailed history, including information about the assault, any injuries sustained, and the patient's current physical and emotional state. Perform a physical examination to assess for injuries and collect any necessary forensic evidence. Administer appropriate medical care. Provide care based on the patient's needs, which may include treatment for injuries, prophylactic medications for sexually transmitted infections, emergency contraception, and psychological support. Ensure proper documentation. Accurate and thorough documentation is essential in cases of sexual assault. Record findings from the physical examination, any interventions provided, and any patient statements in a clear and objective manner. Offer resources and support. Connect the patient with appropriate resources such as counselors, support groups, and legal services to help them navigate the aftermath of the assault. I would like to note that if at all possible, a specially trained nurse called a SANE nurse should be the one to provide the forensic exam. As nurses, our role in managing cases of sexual assault is to provide compassionate, patient-centered care. By prioritizing privacy, building trust, and addressing the patient's physical and emotional needs, we can support them on their journey to recovery. Now let's look at the emergency management of patients who have been victims of human trafficking. Identifying and supporting these individuals can be challenging, but as nurses, we have the unique opportunity to make a significant difference in their lives. Here's how we can provide effective care. Recognize potential signs of trafficking. Develop an understanding of the red flags associated with human trafficking, such as indications of physical abuse, malnourishment, inconsistent stories, or evidence of being controlled by someone else. Maintaining a high level of suspicion can help us identify potential victims and intervene appropriately. Approach with empathy and sensitivity. Recognize that victims of human trafficking have often endured severe trauma. Engage with them in a non-threatening, compassionate manner, prioritizing their comfort and safety throughout the care process. Perform a thorough assessment. Obtain a detailed history, focusing on the patient's physical and psychological well-being. Be mindful that victims may be hesitant to disclose information due to fear or shame, so approach these conversations with patience, understanding, and cultural sensitivity. Ensure privacy and confidentiality. Create a safe environment for the patient to share their experiences and guarantee that conversations and documentation remain confidential to protect their safety and well-being. Administer appropriate medical care. Address the patient's immediate physical and psychological needs by providing treatment for injuries, prophylactic medications for sexually transmitted infections, mental health support, and other necessary interventions. Collaborate with a multidisciplinary team. Work closely with resources such as social workers, counselors, and legal services to help the patient access the support they need to recover and escape their situation. Report to appropriate authorities. If you suspect human trafficking, adhere to your institution's guidelines and local laws to report the situation to the proper authorities while ensuring the patient's safety and confidentiality. In most hospital settings, there is a chain of command that will be followed, and you will not be the one directly notifying law enforcement. As nurses, our role in managing cases of human trafficking is to provide compassionate, patient-centered care while ensuring the safety of both the patient and ourselves. By recognizing potential signs of trafficking, approaching with empathy and sensitivity, and collaborating with the multidisciplinary team, we can help victims access the resources and support they need to overcome their difficult circumstances. Now let's look at key nursing interventions and the rationales behind each action for the scenarios we've discussed. A thorough understanding of the reasoning behind these interventions will empower you to deliver the most effective care possible in each situation. For drug overdoses, monitor vital signs. This is because continually assessing and maintaining the patient's respiratory and cardiovascular status is crucial in preventing complications and guiding appropriate treatment decisions. Administer antidotes when applicable. Employing antidotes such as naloxone for opioid overdose or flumazenil for benzodiazepine overdose can quickly counteract the drug's effects and potentially save the patient's life. For acute alcohol intoxication, position the patient on their side. Adopting this position helps to prevent aspiration if the patient vomits, reducing the risk of complications like aspiration pneumonia. Provide hydration and electrolyte replacement, probably with vitamin therapy. Rehydrating the patient and replenishing electrolytes and vitamins that are depleted due to the alcohol intake can help address alcohol-induced dehydration and electrolyte and vitamin imbalances, preventing further complications and promoting recovery. Sexual assault. Preserve evidence. Proper collection, preferably by a specially trained forensic SANE nurse, SANE nurse, plays a vital role in supporting law enforcement investigations and potentially bringing the perpetrator to justice. Offer prophylactic medications. Administering medications to prevent potential sexually transmitted infections or provide emergency contraception can minimize the risk of long-term health consequences for the patient. For human trafficking, maintain privacy and confidentiality. Creating a safe and confidential environment encourages open communication, fosters trust, and ensures the patient's protection. Connect with multidisciplinary resources. Collaboration with social workers, counselors, police officers, and other legal services helps victims to access the comprehensive support they need to recover and escape their situation. By integrating these nursing interventions with a firm grasp of the rationale behind them, you can deliver effective care for patients in each of these challenging scenarios. Your knowledge, expertise, and empathy make a significant difference in their outcomes and overall well-being. Now let's underscore the significance of adopting a multidisciplinary approach when managing patients in the situations we've examined. Effective emergency care frequently necessitates the cooperation of numerous healthcare professionals, each contributing their distinct expertise to address the multifaceted needs of these patients. So we need physicians. They play a crucial role in assessing, diagnosing, and initiating treatments, guaranteeing that patients receive essential medical interventions promptly and appropriately. We need nurses. As frontline caregivers, we continuously monitor the patients, administer the ordered medications, offer emotional support, and educate patients and their families about the care plan, including what to anticipate during the recovery process. We need social workers. These professionals are instrumental in identifying and addressing patients' psychosocial needs, linking them with valuable resources such as counseling services, housing options, and legal support. We need mental health professionals. Psychologists, psychiatrists, and counselors deliver specialized assistance and therapy, enabling patients to manage the emotional and psychological aspects of their circumstances. We may need law enforcement. In situations involving sexual assault and human trafficking, law enforcement officers are vital in conducting investigations and ensuring the safety of both the patient and the wider community. We need pharmacists. They play a key role in advising on and dispensing the appropriate medications for patients, considering factors such as drug interactions and potential side effects. By combining our forces as a multidisciplinary team, we offer comprehensive care that caters to the physical, emotional, and social requirements of our patients during these highly challenging times. This collaborative strategy ensures that we can have a substantial positive influence on their recovery and long-term well-being. Now let's apply everything we've learned through a scenario that emphasizes the significance of emergency management in various situations. Picture a 25-year-old patient named Alex. She arrives at the emergency department after being discovered unconscious at a party. Upon arrival, Alex appears disoriented and agitated. Preliminary assessments point to a potential drug overdose, coupled with acute alcohol intoxication. Additionally, Alex reveals having been sexually assaulted during the party. Drug overdose and alcohol intoxication. The emergency team promptly administers naloxone to counteract the effects of the suspected opioid overdose and offers supportive care to address the alcohol intoxication. This includes providing IV fluids, monitoring vital signs, and ensuring Alex's safety throughout the process. Sexual assault. The team adheres to proper protocols for patients who have experienced sexual assault, carefully preserving evidence and conducting a comprehensive examination. They supply emergency contraception and prophylactic treatments for potential STIs as required. Emotional support. A compassionate nurse remains with Alex during the entire ordeal, offering comfort, reassurance, and answering any questions that arise. The nurse also helps Alex become familiar with the available resources and options for moving forward, such as counseling and support groups. Multidisciplinary approach. The healthcare team collaborates with social workers, mental health professionals, and law enforcement to ensure that Alex receives well-rounded care and support during this challenging period. This scenario underscores the crucial role of effective emergency management in addressing the complex needs of patients who encounter multiple difficulties simultaneously. By adhering to established protocols and collaborating as a multidisciplinary team, we can deliver comprehensive care that fosters healing and recovery for patients like Alex. So as we conclude our presentation today, let's take a moment to reflect on the key points we've covered. Recognizing the diverse scenarios in emergency care such as drug overdose, acute alcohol intoxication, sexual assault, and human trafficking. Understanding the unique emergency management strategies for each situation, from initial assessment to tailored interventions. Emphasizing the crucial role of nursing interventions and rationales in providing the best care for patients in these challenging circumstances. Acknowledging the importance of a multidisciplinary approach in managing complex cases, ensuring comprehensive care and support for our patients. As nurses, you will undoubtedly face various challenges in the emergency department. By understanding the different scenarios you may encounter and the appropriate management strategies, you'll be well equipped to provide the highest level of care for your patients. Always remember that you play a vital role in their healing and recovery journey, and with the right knowledge and compassion, you can make a significant impact on their lives. Thank you for your attention and dedication to your nursing education. Keep up the great work.